Hello, this is David Green, Education Director at Premier Pain Specialists in Chicago. Today's topic is an overview of RSD and CRPS. Well, what exactly are they? RSD stands for Reflex Sympathetic Dystrophy, and CRPS stands for Complex Regional Pain Syndrome. Both represent chronic pain neurologic syndromes that are very frustrating to both patients and doctors. So they are used interchangeably, but I'll explain the difference. The basic problem is that it's an overactivity of the sympathetic nervous system that results from either trauma, surgery, and a lot of times an unknown cause. In the mid-90s, the International Association for the Study of Pain actually changed the name from RSD to CRPS to try and better characterize the condition, but both terms are still well known in the public repertoire. So how common are they? The total numbers are unclear, but somewhere between 5 and 12 million Americans suffer from RSD or CRPS. 3/4 of those afflicted are female, and a lot of times it's unclear why it occurs. There is that overactivity of the autonomic nervous system, specifically the sympathetic part, which can help control heart rate, constriction or dilation of blood vessels, the fight or flight syndrome. The trigger can be surgery, trauma, or something minor that sparks up the autonomic nervous system and it just doesn't shut off. So the symptoms can vary broadly. It may include severe burning pain that is intense and much stronger than would be expected from the injury that was sustained. The pain usually gets worse over time rather than better. It starts at the point of injury, but it then can spread to the whole leg or arm or even the other side as well. In the early stages, one sees significant sweating, swelling in the tissues, extreme sensitivity to the affected area, even like with wind going over it or just a sheet touching it. You can start to see bone and skin changes, and then insomnia and probably emotional problems. So stage 1 usually lasts for the first 3 months, and it includes skin temperature changes, spasms of muscles, severe burning pain, hair and nail growth that's faster than normal, and then the beginning of some skin changes. It can look blotchy, pale, shiny, and sweaty. Stage 2 is the phase from 3 to 6 months. You start to see more skin changes and maybe some cracking of the nails. The pain continues to get worse, hair growth starts to slow down, and then you can get weak muscles and stiff joints because it hurts so much you're not moving that extremity, so it starts to get stiff. And then the last stage is when the changes start to become irreversible. You start to get muscle wasting, entire arm or leg involvement, even the other side as we mentioned, and then the limb can get so stiff from not being used that it gets a contracture. So what are the treatment options? Well, it is hard to cure, but it can be slowed and reversed significantly. There's a lot of different treatment options because there is no one silver bullet option. Physical therapy can help a lot. Medication management may include narcotics, antidepressants, blood pressure medications, non-steroidal anti-inflammatories, steroid medication, neuropathic medications such as Lyrica or Neurontin, and maybe calcitonin. A lumbar sympathetic block or a stellate ganglion nerve block if the problem is up in the upper extremities. So a lumbar is obviously in the low back, and then the stellate is in the neck area. You can see that in the image here. The needle goes in, and the steroid and lidocaine or numbing medication goes around the sympathetic chain. And that can be very helpful. If it is, and then the pain gets worse again, one can go on to have a surgical sympathectomy. And if it really just isn't getting better, a last resort can be either a spinal cord stimulator or an intrathecal drug pump. Well, what are the outcomes? Well, it does depend on timing. The earlier the treatment, the better the outcome. A large Journal of Bone Joint study from 1980 showed that if treatment was started within 2 years of onset, there's an 80% good to excellent results. If it's between the 2 to 5 years, it's 70%. And if it's out more than 5 years, treatment gets started, then it's much lower at 10 to 20% success. There was a study looking at spinal cord stimulation in 2004 for RSD in 54 patients, and it was a very favorable long-term outcome with very minor complications. And since then, it's been quite a few years since that study came out. Spinal cord stimulation implants have gotten better and better and better. So the results have gotten better and better and better. So lumbar sympathetic block and stellate ganglion block. You saw a picture of lumbar. Here's the stellate ganglion. It goes around this, this plexus of nerves coming off of this area here. You know that these treatments work if it warms the skin of the extremity immediately, okay? Pain relief may occur within a half hour. It can last for days to weeks, maybe even months. May need 1 to 2 blocks per week with about 5 to permanently relieve the symptoms. And if it works and then wears off, an operative sympathectomy may become necessary. Overall, the treatment for these is complicated due to all that we don't know and the varied presentations. So the combination of treatments, the individualized treatments, are typically best and lead to the most successful outcomes. The goal overall is to break the cycle of the sympathetic overactivity, and that can reduce the ongoing pain. The top pain management in the greater Chicago area is with Premier Pain Specialists. There are several clinics throughout the Chicagoland region, accepting over 50 insurances and providing over 20 different treatment options with over 90% success rates with the board-certified award-winning physicians. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-220-7907. Thank you very much for watching.